the big pharmaceutical companies revved up their influence machine to dismantle bipartisan legislation aimed at bringing down prescription drug costs. In July, the Senate Finance Committee, where I am the ranking Democrat, passed legislation that constitutes the most serious and the most significant bipartisan effort in recent memory to lower drug prices. It's the result of months and months of work by members on both sides. And with respect to Chairman Grassley, he and I literally worked every single day for 6 months with our colleagues to try to bring together this bipartisan package. Now, the big pharmaceutical companies want to shred the bipartisan Finance Committee bill into confetti. The bill has two particularly important proposals. First, it has an out-of-pocket cap in Medicare that's going to save senior citizens $27 billion in the next decade. It will end the era when prescription drugs forced senior citizens into bankruptcy. The second key proposal is the one that really has Big Pharma mobilizing their lobbyist armies. It is a provision that stipulates that if big pharmaceutical companies are engaged in price gouging, they're going to face consequences. They are going to be able to set their prices. But if they price gouge, the taxpayer is not going to funnel up unlimited subsidies any longer. That's what that provision that the big pharmaceutical companies are fighting does, and it is literally a requirement that drug companies, big drug manufacturers, when they price gouge, make a payment to Medicare, a penalty, one might call it, that's going to save the Medicare program $50 billion. If the drug companies raise prices faster than inflation, they've got to pay the difference back to Medicare. No more unjustifiable price hikes to please the shareholders at everybody else's expense. And particularly, no more taxpayer subsidies for price gouging on pharmaceuticals in America. For literally years, I had been hearing the big drug companies saying they didn't want price controls. Price controls would be bad for innovation. Nobody wants to freeze innovation. So we went back to the drawing board and we said, okay, you set your price. But if you do price gouge, if you do hit patients and families and consumers in an unfair way, the taxpayer is not just going to ladle out unlimited subsidies. So that's what that provision of our bill does. Unfortunately, the big pharmaceutical companies will do just about anything to protect the status quo, to keep the prices climbing up and the profits rolling in. Their lobbyists are walking the halls here on Capitol Hill. The pharmaceutical company executives are pulling out all the stops from their political headquarters to generate support. Their fear-mongering messages have spread in op-eds attacking our legislation that somehow this bill, a bipartisan bill, written by Senator Grassley, the senior member of the Republican caucus, is somehow a socialist price control. Well, I already talked. It's pretty hard to call it a price control if the company gets to set its prices. But it certainly does limit subsidies, and Apparently, the pharmaceutical companies won't accept any limits there as well. Basically, the pharmaceutical lobby is calling it inhumane for the Senate Finance Committee to try to fix a broken system and bring down pharmaceutical prices. They basically say any effort to hold down prices is socialism. One op-ed said that the Medicare drug program would cease, quote, to function as a market entirely if drug companies lost their constitutional right to limitless price increases. Others have even claimed that drug prices are falling nationwide, which millions of seniors can tell you is fiction based on the trips they take to the pharmacy window. So I've got a bottom line now that the Senate has come back after the summer break. The big pharmaceutical companies have had just about the longest winning streak in Washington. It seems like they've got a couple lobbyists for practically every member of Congress, and yet the Finance Committee voted on a bipartisan basis to actually act in the face of price gouging and protect American patients and families. We cannot let the big pharmaceutical companies win this time. We cannot let them win on that price gouging penalty in particular. They want it gone. They know that this is going to ripple through the American economy because people are going to see, hey, this is a pretty fair approach. The companies can set their prices, but they don't have a right to unlimited subsidies. And I personally believe, and the head of the Congressional Budget Office touched on this before our committee, that I think this has the potential to be copied in the private sector as well. And I think that's a good thing also. So the question for the Senate is going to be, are we going to hand pharma essentially the power of a line item veto where they can go in and strike one provision, the provision that does the most to stop drug company price gouging? Whether pharma gets to comb over our proposals and strike down anything that might curtail their price increases or cut into their profits, that's really what they are seeking to do. If pharma can prevent the Senate from taking even the first basic steps to bringing down drug prices, then the question is, what's going to come next? Is the drug company and the drug lobbyists going to get their own desks here on the floor of the United States Senate? At least then their influence wouldn't just be in the shadows of the nation's capital. Mr. President, the prices of prescription drugs in America are out of control. All this summer I was having town meetings at home. I went to small pharmacies across my state, urban and rural, and usually in these meetings I would ask how often somebody in the audience knew somebody who'd been affected by high insulin prices. Everybody's hand went up. I said, how many of you do have neighbors that have been affected by high insulin prices? Everybody's hand goes up. The fact is, insulin prices have gone up 13-fold in the last few years, and that drug is not 13 times better. It's basically the same drug, it's basically the same insulin that has been around for decades. The reason those prices go up and up and up constantly is because the big pharmaceutical companies can get away with it. Now the Senate Finance Committee is saying you aren't going to get away with it any longer. The days when everybody in the Congress would just look the other way and they could charge anything they want will be over. There was one particularly interesting article written over the course of the summer, Mr. President, with the author using AARP data, who basically said if what Senator Grassley and I and bipartisan members of the Finance Committee had done 10 years ago, there wouldn't be a crisis with drug pricing. His argument, and he went through AARP data, was essentially drugs that had gone up $5,000 over a few years would have gone up something like $500, something much more manageable for American families and patients. So the Senate Finance Committee is moving to actually stop this price gouging, and I don't believe the pharmaceutical industry ought to be able to overrule 19 senators on the Finance Committee, Democrats and Republicans. Pharma shouldn't be able to gobble up $50 billion Medicare dollars that our legislation would otherwise save as part of the effort to stop the price gouging. Our legislation gets to the heart of how drug companies have managed to manipulate and abuse the broken healthcare system for far too long. They've done it with a pretty simple, formula. Just make sure that the United States Senate lets them do anything they want. No constraints on companies at all. Keep the seniors on the hook for huge costs when they're prescribed expensive drugs. And it is not just a crisis in Medicare. A recent study showed that nearly a third of American adults said that at some point in the last year they chose not to take medication that was prescribed because of the cost. And in particular, insulin is cited again and again as a prime example, with tragic stories about people who've died after self-rationing the insulin they needed to manage their diabetes. Rising drug costs forces the people of this country into impossible choices. You're robbed of your savings if you get your prescriptions filled, and you're robbed of your health if you don't. Obviously, that's unacceptable. Mr. President, it ought to be unacceptable to every member of this body, just the way it was unacceptable to the Senate Finance Committee on a bipartisan basis. Now, I did make it clear in the Finance Committee that this was just a beginning. I believe, for example, that it's long overdue for Medicare to have the power to bargain with drug makers directly for lower drug prices. Something like 90% of the American people, 90% of the American people believe that it is time to lift the restriction on Medicare so that Medicare could bargain to hold down the cost of medicine. Weren't able to get that into the bill, but at a minimum, the bipartisan legislation the Finance Committee approved cannot be picked apart by pharma lobbyists, should not be picked apart by pharma lobbyists, particularly on the key question of whether or not we're going to stop pharmaceutical price gouging. On this side, my colleagues and I are going to continue to fight to get this legislation passed by the full Senate. For now, it is up to Leader McConnell to bring our bill to the floor. My message to every member of this body is the Americans who are battling illnesses and struggling to pay for their medications cannot wait. These are people, Mr. President, who are walking an economic tightrope. Every month, they balance their food bill against their fuel bill and their fuel bill against their medicine bill. These are Americans who cannot afford to be shunted aside while the Senate favors business as usual for the drug makers. Mr. President, every one of us knows what this crisis is all about, how big it is. Senators were home for weeks this summer. They heard from those in their communities, in grocery stores, and gas stations, and restaurants, and Dairy Queens. Everywhere you go, when a senator is home, folks come up and tell them a story about how they feel when they get their prescription drug bills that they've been hit by a wrecking ball. I held town hall meetings all over the state. The issue of prescription drug costs came up at every single one. And I'm going to close with this, Mr. President and colleagues. Pharma's winning streak has to end here, and it has to end now. For the Senate to cave and allow pharma to block the price gouging penalty would be an outrage. It would be a dereliction of duty on the part of the United States Senate. I'm going to keep up this fight. I know our Chairman Grassley is going to continue to fight for our bipartisan bill, and I urge senators on both sides of the aisle to stand with us. Mr. President, I yield the floor, and I would note the absence of a quorum.